What is harm reduction? It's policies, programs, and practices that aim to reduce the harms associated with the use of psychoactive drugs in people who are unable or unwilling to stop. Harm reduction is a concept that is very important to understand because the reality of opiate addiction is that some people just can't or are not willing to stop. They will do whatever they need to in order to prevent getting violently ill. Without treatment, drug users may steal, harm others, or harm themselves to feed their addiction. I'm Mike, your pharmacist, and this is The Daily Dose. We find that communities that use harm reduction strategies like methadone maintenance treatment or Suboxone maintenance treatment see a drop in crime rates. So not only does this program have a positive impact on patients, but it can also be beneficial for the community. Harm reduction was first introduced to prevent the spread of HIV amongst injecting drug users, to decrease the spread of the illness and decrease the socioeconomic impact of HIV. Now we are using variations of that approach to combat the opiate crisis. Methadone and Suboxone are harm reduction strategies that are widely used today. These are long-acting opiates with a slower onset of action than heroin and other highly addictive opiates. So why are some opiates more addictive than others? As a general rule, drugs that have a quick onset of action and a short duration of action tend to be more addictive. Essentially, drugs that have a quick on, quick off effect are more addictive. Now, methadone and Suboxone, they're thought to prevent that immediate high because it has a slower onset of action and a longer duration of action, and that's why they are thought to be less addictive. But isn't substituting heroin with methadone just substituting one addiction for another? Essentially, yeah, it is. It isn't substituting one addiction for another. The hope here is that reducing the continued craving of drugs can help patients make positive changes, like find steady work or work on their personal relationships. These programs are incremental in their nature. Drug users are much more likely to take multiple tiny steps rather than take one or two huge steps. The idea here is that small gains for many have more benefit for a community than heroic gains achieved for a select few. Harm reduction initiatives have a hierarchy of goals. Health clinicians acknowledge that there are several extremely important health priorities, but most of the attention is placed on keeping people who use drugs alive and preventing irreparable damage. Abstinence from drugs would be at the end of that hierarchy. Another point of emphasis is the prevention of harm, rather than on the prevention of the drug use itself. Harm reduction is based on the recognition that many people throughout the world continue to use psychoactive drugs despite even the strongest efforts to prevent the initiation or continued use of drugs. An example of a harm reduction goal is to decrease consumption of drugs or decrease a specific route of administration, like stop injecting drugs while actively accepting that a client may be taking drugs orally. Other harm reduction strategies are education on safe opiate ingesting practices, access to safe supplies like sterile needles, alcohol swabs, mouthpieces, foil, meth pipes, sterile water, condoms, and safe disposable containers, easy access to naloxone kits and training to use in case of an overdose, vaccinations for preventable illnesses like hepatitis B, and tests for infections like HIV, hepatitis B, and Hep C. More recently in Ontario, we're starting to embrace supervised consumption service sites. These are spots that are exempt from the Controlled Drugs and Substances Act. In these spaces, people can consume illicit drugs, whether by injection or inhalation, in a safe, supportive, hygienic environment under the supervision of staff who can intervene in the event of an overdose or other adverse effect. How does harm reduction affect me? Methadone maintenance treatment programs have shown to decrease crime and public drug abuse in communities. Harm reduction initiatives are also relatively cheap. For example, education and clean supplies can prevent serious illnesses like Hep C and HIV, which can literally cost hundreds of thousands of dollars to treat. It also decreases the prevalence of the serious illness within society, preventing the spread of it. With that being said, it is still an extremely controversial topic that needs much improvement. Some believe that abstinence should still be the number one goal. From a socio-economic perspective, some may not want to spend tax dollars on harm reduction initiatives like methadone or naloxone kits. Another concern is methadone or Suboxone being diverted on the street. Pharmacists and physicians and policymakers do what they can to prevent diversion, but We're not cops. Opiate drugs have street value, and this program inevitably supplies the street. There are also issues with the program itself. Patients are still dependent on an opiate, and the program requires frequent doctor visits and observed doses at the pharmacy. It makes it difficult for clients to keep a job. It's even difficult to start a job once they are stable because methadone shows up in urine tests. There's a stigma that comes with methadone treatment, so clients feel the need to hide it from coworkers, family members, and the community. And frequent doctor visits and pharmacy visits make keeping methadone maintenance treatment a secret very difficult. I work in methadone and Suboxone dispensing pharmacies regularly, and I can tell you that it comes with a lot of very difficult decisions. I have my own opinions on harm reduction initiatives and how it can be improved, but I do enough talking. What's your opinion on harm reduction initiatives aimed at managing opiate addiction? Do you have opinions on how this program can be improved? Leave a comment below. I'm Mike, your pharmacist, and thank you for joining me on the Daily Dose. If you found this video informative, please leave me a like, comment, or subscribe for more health education videos.